or side facing me. The reason why you need this is to protect the patient and yourself, right? So the patient's gonna scoot way close to the edge of the table. You're gonna use a pillow to make a barrier between you and the patient, right? Because you're gonna lean over the patient. Some patients don't like that. Scoot closer to me. All right, so their hand rests on top of their side. So what do you guys know that when you raise your arm overhead, which directions is the scapula moving? So, no, you're going into flexion, just straight flexion. Okay, so it posteriorly glide, inferiorly tilts, right? That's the first scap thing we're gonna do, okay? So what you're gonna do is stagger stance, put your left foot, if you're working on this side, I like to put my left foot forward, right foot back, lean over the patient, and what you're gonna do is you're gonna find that inferior angle of their scapula, right? And you do like a hamburger or what's called a lumbrical grip. Lobster hand. Yeah, so you're gonna grab that inferior angle with your lobster hand, okay? This hand comes to the front of their shoulder, and what you're gonna do is you're gonna gently push back. So just a little back to set the shoulder blade on here. The reason being is this is your scapula, this is your rib cage, it sits on top of it. You need to get it over the lateral angles of the ribs. So by grabbing with your lobster claws and pushing back a little bit, that sets it where it needs to be. The technique is basically you're going to shift that way. So it's a posterior tilt, inferior glide. So I'm here grabbing Robert, my hands are on the top of his shoulder. I'm just gonna posteriorly tilt, inferiorly glide. So just like that. So all I'm doing is I'm doing this.